Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. I'm 50 hairs shorter than I was earlier today, and I'm here with Dr. Millicent Rovelo, who has retained all of her hair.
All of her hair is but covered in goosebumps because literally the studio is 59 degrees.
It is
Actually,
so cold.
59. It is so cold. But you know what? I'm here. I'm taking one for the team. Thank you for giving your hairs to science. You know, we're all doing our part today.
I did. I donated I didn't donate. I'm getting my hairs pulled so that I can get my own exosomes. And I don't want to talk about it much today.
Not yet. Not today.
Because it's just coming into our practice now, and I am very, very excited about this. So you'll hear about it more in the future, but I can tell you that getting my own personal exosomes is what I've been waiting for, because I never thought it would make sense to get like turtle exosomes put on my face or plant exosomes. And now there's a way I can get my own. And so it cost me 50 hairs, but
worth it.
I'm looking forward to it.
Amazing. Well, stay tuned for that topic. That'll be the next one.
It's a little teaser for the future.
But that is not what we are talking about today.
No.
Today,
we've got an easy answer for an easy question.
So yes. So this one came in through one of our very loyal listeners, and it was a whole series of questions that we appreciate.
We do.
We do.
By the way, if you guys have questions, send them to us.
Send them in.
DM us either on our accounts or on the Beverly Hills Plastic Surgery Podcast account, or send smoke signals, whatever. But let us know that you have questions, because we answer them. This listener is awesome. She's sending us all kinds of questions about I think the Motiva implants have sparked a lot of inquiry into like, well, what about this and what about that, and breast implants this and breast implants that. And her questions were really about, if they're not big enough after I get an augmentation, what do I do?
Right. Oh no, pretty much that was the gist of the question.
There are a lot of them.
There's a lot of them, but they all boil down to, should I just get bigger implants? And the answer to that is
yes.
Yes.
Yeah. Okay, podcast
We're
over.
done, right? Yeah. No.
But she had a lot of like good insight into like what ifs and how to, and does this work? And so just to cover those, I think it's really important. Her questions really were about, if they're too small, could fat grafting be an option to like improve the look of the cleavage, or to fill out the lower pole? Or, is there a way that fat grafting is a way to help if I didn't get the oomph that I wanted from the breast implant operation that I've had?
Or should I just get bigger implants? And if I get bigger implants, what's the complication related to that? And what's the cost associated with that? And what's the timeline for that? So just a lot of questions that overall are like, what should I do if I actually really like my implants? I just want them to be a little bit bigger,
and
or a lot bigger.
And I'm starting to think that she didn't get the big enough implants. That's why she's asking the questions. Which is fine.
Which is fine.
Just, we're going to answer all those questions because, by the way, this happens
all the time. And it's a joke amongst plastic surgeons, and perhaps not everyone else will find it as funny, but it's the old joke of like, there are two sizes for breast augmentation. Too small and just right. Like that's the joke. And okay, put that out there. Yes, you can definitely have implants that are too big, and we will touch on that.
And then you'll downsize
we're,
those. That's
we're
different.
jesting. Not everyone needs like bigger and bigger and bigger implants. But that does seem to be a pretty common theme, is that you have your starter pair of implants and you really like them, and you think maybe I can go just a little bit bigger. And then in general you can, with some caveats for sure.
And I will tell you that, we just did a breast augmentation on one of our amazing staff members, and her immediate response was, you could have gone a little bigger. And it's like not even like healed yet.
I know.
I was like,
and she's still swollen.
So this is for you.
So this is for, yes.
So does fat grafting play a role in like, my implants aren't big enough, can I get fat grafting?
Right. Well, actually, let's back it up to the very beginning. So say you've had your implants placed and you love them, they're great, they're like fun for everyone, but you wish you were a little bit larger. And so how long do you wait? And so that's going to follow the course of your swelling and things healing. And so I would say in general, most of your swelling, about 90% of your swelling, will be gone at about 6 weeks, but 3 to 6 months to really see final size, shape, and position. So I would not go in and do any kind of size exchange before 6 months, because you're going to really need to see how they finally settle in and sit.
I think that's exactly right. I would say 6 months.
Minimum.
Because there will be more settling in the 6 to 12 month range, and obviously 12 months and beyond, they do change. I mean, there was a patient who said something to me this week, and it stood out to me and said, well, but will this be permanent?
No.
And I'm like,
nothing on our bodies is permanent.
I wanted to get so deep and existential on this one. Like, well, permanent's a big word in this world, don't you think? But it's like nothing's permanent with the human body, and nothing's permanent about plastic surgery, and nothing's permanent with a medical device that's trying to live in harmony with your body. So,
it will change.
So permanent is not a way to look at this.
Yeah, and to be clear, we're talking about primary augmentations. If you had a revision augmentation, you're looking at probably closer to a year to see final settling and position of the implants. But say you've waited your 6 to 12 months and you're still just not totally happy with the size. So then that becomes, what are your options? And they can fall into a couple different categories. You mentioned fat grafting. Our listener mentioned fat grafting. Fat grafting is when you harvest your own fat, you wash it, and then you inject it right back into your body. And it's great. We all love fat grafting. We do have some podcasts out there specifically about fat grafting to the breasts. And there's a couple different ways you can look at this. If you are someone that has a decent amount of fat to donate to yourself, then you can actually make a little bit of a size change with the fat that you put into the breasts. And you can get, I would say, maybe half a cup size bigger with one round of decent fat grafting.
I agree.
If you want to go back and be bigger with fat, you might have to come back for another second or third round, assuming you have the fat stores to do that. If you're someone that doesn't really have a whole lot of fat to give, you're looking at small changes in the contour of the breast or of the shape, maybe a little more cleavage in the center. You can put a little bit of fat through that center part of the breast to soften it and add some cleavage. But if you don't have a whole lot of fat, you're not going to get dramatic results from these kind of interventions.
Agreed. I mean, I think you can get a half cup. It's hard to go up a cup size with fat because what fat does
in the first round.
Yeah. What fat does is it takes whatever you have and just expands it.
Yeah.
So like whatever your breasts look like, people say, oh, can I get a breast augmentation with fat? And the answer is you can, but it's not going to be like getting breast implants. It's going to be like taking what you have and just blowing it up bigger. Yeah. So if you have beautiful breasts to start with, then you're going to have beautiful breasts that are bigger after with the fat, maybe a half cup size. Yeah. If they're saggy and you need a lift and all that stuff, it's not going to change anything. No. It's not like putting in an implant. And so fat grafting's great. It can, in patients who say, I want a little bit more, I say, well, how much more?
Yeah.
Because her other question too, which goes into that, is like, how much of a change would warrant doing an exchange of implants.
Right.
So like if what we're talking about is probably something that would be equivalent to maybe a 100 cc difference in a breast implant size. So if you have a 400 in and you want to get to a 500 or 475, then maybe fat grafting can do that for you.
Maybe fat grafting can do it. And the other thing that I do find helpful for fat grafting a little bit this is a little bit different topic, but in patients that actually want to keep small implants, they don't want to be large. But they do want some cleavage. And so here's the thing. If you want cleavage, you kind of have to have volume in the center of your breasts. That's how you get cleavage. But if you don't want to have a big implant that comes close to the midline, then sometimes fat grafting can allow you to keep the smaller implant while giving you maybe a little bit more cleavage in the center. So that's what I would say about fat grafting. But no, it's not going to change your size dramatically. So then the question becomes, how much bigger an implant do I need to see an actual change in my size? Like, nobody wants to go through OR and anesthesia and a surgery recovery for like a meh improvement in size. So like, how much bigger an implant do you need to exchange up to see that change in size?
Well, that depends on the patient, because if the patient is 5'2" and has 400 cc implants in, then to see a difference, you probably need 100 cc's to see a difference. If the patient is 5'10" and has 450 cc implants in, you might need 150 cc difference, maybe even more, to actually see that difference. You know, because to perceive the difference, it will be bigger either way. Like if you're 5'10" and you have 400 cc implants and you put in 500s, they'll be bigger, but it won't be like a noticeable difference. I would say that's not worth it.
Right. Because if you think about someone who's taller, they just have more surface area to fill out.
Right.
And so that extra 100 cc's is going in a larger surface area. And so you're not going to see as big a difference as opposed to someone who's more compressed, 5'2", they have smaller surface area, so 100 cc's makes a bigger difference in them.
Right.
But 100 is kind of my standard number for seeing up to a cup size, half a cup size. But again, if you're taller, then you probably need something like 150, maybe 200 to see that change in a cup size.
In general, I typically think of 200 cc's, 175 to 200, as a bra cup size. And again, bra cup size is like it's so made up. There, you can't go to Washington D.C. and go to the Bureau of Standards and Weights and Measures and find,
Excuse me,
this
sir.
is an A cup.
I'm looking for a B cup.
This is a B cup. Yeah. This was anointed the C cup by, John Adams. They didn't do
doesn't
that.
exist.
So there is no cup size standards. And I always talk about like Victoria's Secret. Victoria's Secret, if you go there and look at the bras, like girls will come out very excited. They're like, oh my God, I'm a triple D. I was like, no, that's not a triple D. Like in that, it is because it is at Victoria's Secret. But if you went to Kmart, you'd be like, a B, maybe a C.
Yeah.
And that's the thing, is that there is no way to decide what the breast cup size is. But in general, the way to think about it is with the look of the breast. And so 200 cc's gives a look of a cup size bigger in my world. Maybe you could say 150 in a smaller person, 200 in a larger person.
I think those are very reasonable numbers. I think 150 in a smaller person, 200 in someone that's taller. And then the question becomes, how is it worth it? So that's kind of the question that I think most women, and some people just know they want bigger and they're going to do it no matter what. But I think what a lot of women grapple with is like, my breasts look great. They're not causing me any problems. Yes, I would like to be bigger, but what's the downside? Like, can I make it worse? Because that's the last thing you want, is to take something that looks really good and is doing well and then potentially creating a problem that you didn't need. So all surgeries are going to have risks. There's no way to avoid a complication, and that is important to know. Now, if you had a surgeon that you went to and you liked that surgeon and you have trust in that surgeon and they gave you a beautiful breast augmentation the first time around, then there's a solid chance when you go back to that surgeon, you're going to have a very similar result again. So the risk profile, if you did well the first time, is pretty low that you're going to have another issue the second time. Now, if you're going and you're doing something super complex and adding a lift and a mesh and doing all kinds of more crazy stuff, well, then that becomes a complex revision and you're going to have more complications. But if it's a straightforward increase in size, the chances of having problems are on the smaller side, but obviously they're not zero.
It's never zero.
It's never zero.
I always think that the chance of being killed by one of my chihuahuas is very low, but it's not zero.
But it's not zero.
And that's the thing with surgery. It's not zero.
It's not zero. And I think, we were kind of joking earlier about like, yes, of course you should go bigger, but there's also, it's very important to understand, bigger implants, bigger problems, 100%.
Without a doubt.
It is a linear association. And so there is a point where going bigger actually is not advised. And that's a very personal decision that you have to talk with your surgeon about, what that number or what that size is for you.
Yeah, I can tell you cases where everything was fine, 600 cc implants in, it's amazing. Oh my God.
Home run, high five.
Right.
Yeah.
I'd just like to go a little bigger. Can I do the 700s? Can I go up to that? Because I really think it would help me in never mind. Yeah. But whatever. Okay, here are the risks. All these things are, capsular contracture. It's a revision procedure. It's not a primary anymore. You have to factor these things in. You can't just willy-nilly go off to the operating room.
Yeah.
You cannot. And I can't emphasize this enough, because people think because they've had previous success that it is a predictor of future success, which in general it is.
Yes.
In general it is. But again, it's not always that way. And sure enough, wicked capsular contracture. I have a patient that had I worked like a dog to take care of the capsular contractures that she had, and did capsulectomy, worked on the folds, reconstructed, fat grafted all the missing tissue that was like chunked out by the previous operation, worked and worked and worked, and everything looked beautiful. But one fold was a little lower than the other. And I just have to have this fixed. I said, they're so close, and I'm not going to, I don't want to do this. I just feel like we had so much to do to get here.
This is a win, yeah. Take the W,
went to another surgeon, infection, implant out for like a year, reconstructed, another fail, reconstruct, and I was out at that point. I tapped out, and sure enough, it took a long time. She's finally back to where she needs to be, but it was so like, it's gut-wrenching and heartbreaking at the same time.
It's awful. And that is something that's so important. So if the surgery that you're coming off of or that you're looking at is going to involve or did involve a lot of complex work, maybe really good is good enough, and we don't strive for perfect in those situations. Like you said, someone going from a 600 to 700, maybe that 100 cc difference is what causes the capsular contracture.
Right.
These are the things we know with larger implants. Number one, higher risk of capsular contracture. Capsular contracture is when you get hardening of the scar tissue or the capsule around the implant. That incidence goes up the larger the implant you have. Infections, wound healing issues, and most importantly, I would say implant displacement. So this is where the implant goes somewhere it's not supposed to go,
right,
either off to the side or falls down a little bit on the chest. Because the bigger you go, the heavier these implants are. And so they're going to sort of slip and slide and respond to gravity and potentially go places that you don't necessarily want them to go. So yes, going from, say, 300 cc's to 400 cc's, not a big deal. Going from 500 cc's to 750, you might see some problems. So there is something to be said about that. And then also, again, it depends on your size. You have someone who's 5'10" and goes from 550 to 750, they can probably take it like a champ, and it's fine. So it is sort of a unique sort of thing you have to talk about with your plastic surgeon. Hey, what are my individual risks when it comes to upsizing?
Yeah, and now there are these, giant gel implants. Now you can go up to 1450.
They're huge.
They're
bigger than my head.
They're awesome. I mean, I haven't had a request for them yet, but I'm sure it's coming because somebody asked me, do you think you're going to do this, new technique with the with this, this new implant thing where you put in these 200 cc implants or whatever? I'm like, yeah. I was like, it's just not. I haven't put in 200 cc implants.
Yeah. I do.
You do.
Yeah,
you definitely do.
Small implant patients.
No, mine are fitness models that are in general tall, and they need 500s and up.
Yeah.
And that's what it's because of their body habitus. It's not because they want to have like a big number implant. It's because that's what looks great on them.
They're tall. Their shoulders are broad. Yeah, they need it.
And they are fitness people. And this is like a specialty area of my practice. And doing redoing fitness models and redoing the disaster implants because by the way, doing implants on fitness models is not easy.
Oh my gosh, it's so hard because they have like 1% body fat and they're constantly flexing their muscles or pectoralis muscles. So yeah, they're tricky.
There's a real art to doing it, and the repairs are even harder. And I can tell you that they take a lot of work, and I don't know how I got into this, but it's something I do. But I have a lot of these, and these women look like. They just look like superheroes. Like their bodies are like insane. They do. They look like comic book drawings of superheroes, and it's unbelievable what they do. And they, one patient was telling me, he's like, "Oh, well, I'm in my shred phase now, so like today I get to have 12 almonds." And it's like, and then she's gonna go train and lift weights like she's getting in competitions. I'm just like 12 almonds. Like, what they do
insane.
It's amazing, and but it works, and they do these competitions, and so they going larger is always sort of on their mind as long as it can look good, and so that's the other take home message for that too is like. Going larger is great, but you want it to be, good looking. You want it to be pretty.
You want it to be pretty.
And awesome.
You can always go larger, but that's not to say that it's going to look great. Because there are some people, when you put in larger implants, it makes them in general look bigger and fatter and larger. So especially people who kind of maintain or keep weight around their shoulders and their upper arm area and their upper back, those are people you have to be really careful about going too big with their implants because they can just make them look so top heavy.
Right.
But if you're, you have the small shoulders and you're a little more narrow, then sometimes you can get away with putting the bigger implants and not looking overall bigger. So,
There you have it. I think that's
I feel like
kind of
this
it.
was kind of like it's like a big fat it depends question.
No, I think the answer is yes.
Answer was yes, but it
Yes,
depends.
and.
Yes, and.
Yes, and.
Not yes, but.
No, yes, and.
Yes, and.
That's right. Yes, and we need to discuss.
So again, thank you for sending in these questions. We love receiving them.
Send more.
Send more. Keep them coming.
Yep. Ask, tell us what you want to hear about. We will
right
respond. In that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.